And I'm slowly starting to build community engaged projects into more so my scholarship. So like the queer and trans people of color healthcare experiences project, we are working with a couple of local organizations. So that where previously I would have maybe had a couple of conversations, that was like a 6 month, it feels almost like a courting process, like it was like a 6 month long deliberate conversation about what resources as faculty we might offer them to fill gaps that they might have, and also how that might reflect back into our scholarship. So like one of the things that came out of a lot of those conversations is that from a community, and most of that research is based in the greater Lansing area, there's a lot of, it seems more like word of mouth understanding of what the experiences are of queer and trans people of color, but really not a lot of data. And that for this organization that we're working with, which is more of like, they're really focusing on the medical side. They need data to bring to healthcare providers to make the pitch that they've got to up their training on how to properly work with queer and trans people. And so that feels like the kind of work that I want to do, and it's feeding my scholarly interests and also is giving back to the community in a way that is beneficial. So I guess one thing that I have learned is that being here, maybe because I can see myself here in like a longer time horizon. At Duke, it was a postdoc, so it was capped. At App State, I love the mountains and I love the people that I met, but I knew early on that it felt too isolated for me. And I need to be around more people. So I guess being at MSU, it feels like I might be here longer. And so it makes sense to like slow it down and just get to know like what is the environment, like what is the context in which I'm living and working. Yeah, so I guess maybe my definition of community engagement has shifted to have like a more relaxed, slowed down version of